Gynecological cancers are those cancers which originate in any part of the female reproductive tract. It could arise from the uterus, the inner layer of the uterus commonly known as the endometrium, or the lower portion of the uterus which is called as the cervix. It could also arise from the ovaries, which is the ovarian cancer, or the tubes, or it can arise from vagina or vulva. Sometimes also from the body of the uterus, which are muscular tumors. Gynecological cancers are the leading cause of death in women, like the endometrial cancers mainly in the West, and in the in the third world countries it could even be in cervical cancer. But on the contrary, ovarian cancer is one cancer which is the most aggressive cancer and very lethal cancer, whereas endometrial cancer is relatively detected in early stages and has a better prognosis. Cervical cancer, although there is a downward trend, is also having a good prognosis, whereas the other vaginal and vulvar cancers are relatively low. Each cancer has a different cause, each cancer has a different presentation and different management approach. For example, cervical cancer is something which is mainly or solely caused by a virus called as human papilloma virus, whereas endometrial cancers is more of a lifestyle associated cancer. It is mainly seen in women who are obese, hypertensive, diabetes, and sometimes with a family history of endometrial cancers also. Whereas ovarian cancer and breast cancer being similar to it, these are those cancers which are mainly seen in those women who have a strong family history of hereditary breast or ovarian cancer. The management approach for each of these cancers is different, as well as the way we diagnose. Of course, diagnosis usually has common modalities like ultrasound, we may use a MRI scan, and rarely a PET CT. And also for ovarian cancers, we also use like tumor markers. There are common tumor markers which are the blood tests in which the markers can be elevated in different subtypes of cancers. So after evaluating on a clinical examination, taking a detailed history, doing the various tests, we then arrive at a diagnosis, and then a plan of action is formulated, usually in a multidisciplinary tumor board, wherein we not only have the surgeon, not only is the person who's there, we also have the radiation oncologist, we also have the medical oncologist, all in together give a final cumulative plan of approach, especially for advanced cancers. But many of the cancers, gynecological cancers, are treatable and curable, especially in the early stages. So that is when a gynecological oncologist is the one who takes a call on these cancers. For example, in cervical cancer is mainly treated in the early stages by surgery, in relatively more advanced stages by radiation and chemotherapy, whereas endometrial cancers are the ones which are predominantly treated by surgery, and ovarian cancers are the ones which are treated by a combination of surgery and chemotherapy.